Assalamu alaikum. Hello, ladies and gentlemen, and thank you for this opportunity. Today, I will present our study titled Humanistic Digital Marketing Strategies in the Digital Health Era, a systematic literature review on building trust, empathy, and patient centered relationships. This research explores how digital marketing in healthcare must go beyond promotion and instead focus on building ethical and meaningful relationships with patients. In the era of rapid digital transformation, trust and human connection remain essential in healthcare communication. Therefore, we apply a humanistic digital marketing approach, emphasizing trust, empathy, education, and long-term engagement. The study uses a systematic literature review (SLR) method to analyze recent scientific findings from 2020 to 2025. Our research team consists of 3 members who work collaboratively to complete this study. They are Dr. Tolib, Dr. Vidya, and Dr. Zeddodin. Each member contributed to the development of this research through teamwork, discussion, and academic collaboration. With a shared commitment to scientific integrity and healthcare improvement, the team successfully completed this study. We would like to express our appreciation for the dedication and cooperation that made this research possible. The healthcare industry has experienced a major transformation driven by digitalization and changing patient behavior. Today, more than 77% of patients worldwide search for health information online before choosing a healthcare provider, and over 60% in Southeast Asia compare hospitals digitally. In Indonesia, telemedicine usage increased 6-fold during the pandemic, reaching 13 million monthly users. However, many healthcare organizations still use digital marketing purely for commercial promotion, which risks damaging public trust. Therefore, there is a strong need for a human-centered digital approach that emphasizes ethical communication, education, and emotional connection with patients. This is the foundation of the humanistic digital marketing concept. Despite the rapid adoption of digital marketing, many healthcare institutions face significant challenges. First, human touch is often lost in digital interactions, reducing emotional connection between healthcare providers and patients. Second, overly promotional marketing strategies can harm credibility and reduce public trust. Third, many hospitals struggle with digital capability gaps, limited resources, and poor strategic planning. Additionally, there is a research gap in integrating digital marketing with human values such as empathy and ethics. Therefore, a new framework is needed to align technology with compassionate, trust-based healthcare communication. This study has 4 main objectives. First, to identify patient-centered digital marketing strategies used in the healthcare sector. Second, to analyze how these strategies build patient trust through transparency and credible communication. Third, to explain the role of empathy in digital interaction between healthcare institutions and patients. Finally, this study aims to develop a strategic framework for implementing humanistic digital marketing in hospitals, clinics, and telemedicine platforms. The ultimate goal is to strengthen digital communication while maintaining human values. The article is structured into 5 main sections. The introduction explains the research background and problem statements. The literature review discusses key theories such as Marketing 5.0, trust theory, and patient-centered care. The methodology section explains the systematic literature review approach used to collect and evaluate relevant studies. The findings and discussion present 3 key pillars of humanistic digital marketing strategies. Finally, the article concludes with practical insights and recommendations for future research and healthcare implementation. The evolution of marketing provides a strong theoretical foundation for understanding digital transformation in healthcare. In Marketing 1.0, the focus was primarily product-oriented. Hospitals highlighted facilities and medical equipment, while patient needs were rarely prioritized. In Marketing 2.0, healthcare organizations began to recognize patients as consumers with individual preferences, introducing service differentiation and segmentation. However, communication remained mostly one-directional. Marketing 3.0 shifted toward human-centered values, placing emphasis on emotional connection, compassion, and patient dignity. Marketing 4.0 introduced a major transformation through the integration of digital platforms. Patients became active information seekers and decision-makers, especially through online reviews and social media. Finally, Marketing 5.0 combines advanced technology such as AI, automation, and telemedicine with human values like empathy and trust. In this stage, technology does not replace humans but enhances human connection. In healthcare, this means delivering digital services while maintaining compassion, care, and ethical interaction. This evolution highlights the urgency of humanistic digital marketing as a balanced approach between digital efficiency and emotional connection. Patient-centered marketing emphasizes that healthcare is not just a service industry, but a relationship-based field built on trust and ethical communication. This approach shifts marketing from persuasive promotion toward value-based communication. It ensures that every form of interaction, blogs, social media, telemedicine, or chatbots, deliver meaningful benefits for patients. The core principles include added value, where education and health awareness are prioritized over sales. Humanizing technology, ensuring digital tools remain warm and empathetic. Transparency, particularly in diagnoses, costs, and treatment procedures. Participation, giving patients a voice in healthcare decisions. And universality, meaning information should be accessible for all literacy levels. Unlike traditional marketing, patient-centered marketing builds emotional connection and long-term relationships. It also supports trust building because patients feel respected, well-informed, and genuinely cared for. In essence, this concept guides healthcare institutions to place humanity at the center of digital interaction. Patient-centered marketing creates significant strategic impact in healthcare organizations. First, it transforms hospitals from being merely treatment providers into health partners that accompany patients throughout their journey, from prevention to recovery. Second, it increases patient loyalty and satisfaction, as patients prefer healthcare providers who communicate transparently and respectfully. Third, it supports digital transformation with ethical responsibility, integrating AI and telemedicine while maintaining patient trust. Fourth, it enables data-driven personalization, where digital tools provide tailored health education, reminders, and programs. However, this strategy also comes with challenges. Not all patients have equal access to digital tools, especially the elderly or those in rural areas. There is also a risk of dehumanization if automation is used without empathy. Some organizations face limited budgets and digital skills, slowing implementation. Additionally, maintaining patient privacy and data security is essential to avoid losing trust. Overall, this strategy is effective, but it requires strong commitment, training, and ethical guidelines. Trust is the most valuable currency in healthcare and a critical factor in digital communication. Without trust, even the most advanced digital platform will not be accepted by patients. Trust is built through information accuracy, professional communication, data security, and clinical credibility. Patients must feel safe when interacting with healthcare providers online. Alongside trust, empathy is equally essential. Empathy means understanding a patient's emotions and responding with care. In digital communication, empathy can be shown through supportive language, active listening, personalized responses, and emotional awareness. Research shows that empathetic communication increases compliance with medical advice and improves patient satisfaction. Trust and empathy work together as a foundation for strong digital relationships. Trust ensures confidence, while empathy builds emotional connection. When combined, they create meaningful patient experiences that lead to loyalty and long-term engagement, even through digital channels. The ultimate goal of humanistic digital marketing is not only to attract patients, but to empower them. The journey begins with patient engagement, where patients start interacting with digital platforms, reading health content, watching webinars, or contacting clinics through chat. Engagement increases awareness, but does not always change behavior. The next level is patient activation, where patients take active responsibility for their health. Activated patients manage their own health records, follow treatment plans, and make informed health decisions. Digital tools such as patient portals, mobile health apps, and telemedicine systems help this process by giving patients access to information and medical support. However, emotional motivation is also needed. This is where digital empathy and personalized communication play a key role. Studies show that activated patients recover faster, have better treatment adherence, and build stronger bonds with healthcare providers. Therefore, patient activation is a key indicator of successful humanistic digital marketing. This study uses the systematic literature review method to collect and analyze previous research in a structured, transparent, and scientific way. The SLR approach allows researchers to identify patterns, trends, and knowledge gaps within a specific research area. In this study, SLR was chosen because it provides a strong theoretical foundation and minimizes researcher bias. Instead of collecting primary data directly from hospitals or patients, this method synthesizes findings from credible academic sources. Articles were selected from reputable international databases such as Scopus, PubMed, ScienceDirect, ProQuest, and Google Scholar. The review focuses on studies published between 2020 and 2025 to ensure relevance to current digital health developments. Keywords such as digital marketing in healthcare, patient trust, empathy, telemedicine, and patient engagement were used during the search. Through a systematic selection and screening process, only studies directly related to humanistic digital marketing were included. This method ensures that the conclusions of this study are evidence-based and academically valid. To ensure the quality, validity, and relevance of the selected literature, this study followed the PRISMA, Preferred Reporting Items for Systematic Reviews and Meta-Analyses, protocol. The selection process consisted of four main stages. First, identification, where a large number of articles were retrieved from various databases based on defined keywords. Second, screening, where duplicate articles were removed and titles and abstracts were reviewed for relevance. Third, eligibility, which involved a full-text analysis of each article to determine whether it met the inclusion criteria. Studies that were commentaries, opinion papers, or lacked methodological clarity were excluded. Finally, inclusion, where the most relevant empirical and conceptual articles were selected for analysis. Only studies that addressed trust, empathy, patient-centered communication, or humanistic digital strategy.
After selecting the relevant articles, the next step was data extraction and thematic analysis. Each article was reviewed to identify important information such as research objectives, methods, findings, and conclusions. Key variables such as trust-building strategies, empathy and digital communication, patient engagement tools, and technological approaches were systematically categorized. A coding system was used to identify recurring ideas and consolidate them into themes. From this process, patterns and relationships between concepts were identified. The analysis then grouped strategies according to their role in humanistic digital marketing in healthcare, such as educational communication, emotional interaction, and technology-supported services. Both qualitative synthesis and descriptive comparison were used to interpret findings across studies. The analysis also included a mapping of benefits and challenges associated with each strategy. This structured approach enabled the research to form a clear and coherent conceptual framework. Based on the synthesis of the reviewed literature, the study identified three key pillars of humanistic digital marketing in healthcare. The first pillar is educational content marketing, which builds credibility by providing accurate and helpful health information through blogs, videos, webinars, and online articles. The second pillar is two-way social media engagement, where healthcare providers use platforms like Facebook, Instagram, and YouTube to build emotional connection and interactive communication with patients. The third pillar is transformative technology with empathy, which includes AI-powered chatbots, telemedicine platforms, and patient portals designed to support personalized and compassionate care. These strategies do not stand alone. They work together to promote trust, empathy, and patient involvement. Unlike traditional marketing, this approach prioritizes human values over aggressive promotion. These pillars are essential for healthcare organizations seeking to modernize their digital communication without losing their human touch. Educational content marketing plays a crucial role in establishing trust and authority in the healthcare industry. Patients today search for reliable health information online before making medical decisions. Therefore, hospitals and clinics must provide content that is not only informative, but also accurate and easy to understand. This includes blog articles, medical explainer videos, infographics, digital brochures, podcasts, and Q&A sessions with doctors. Such content helps reduce patient anxiety by clarifying medical procedures and offering preventative health education. For example, Cleveland Clinic's Health Essentials blog is one of the most trusted medical blogs globally because it consistently delivers scientifically verified information. Educational marketing also combats misinformation, which is widespread on social media. Importantly, this approach builds long-term trust without relying on aggressive promotion. Instead of selling, it focuses on empowering patients through knowledge, making it a humanistic strategy aligned with ethical healthcare communication. Social media engagement is a key component of humanistic digital marketing in healthcare because it enables interactive communication between healthcare institutions and patients. Unlike traditional media, social media provides a space for dialogue, emotional connection, and active participation. Hospitals can use platforms such as Instagram, Facebook, YouTube, LinkedIn, and TikTok to share educational content, patient stories, health campaigns, and service information. More importantly, engagement is built through real interaction, including responding to comments, answering patient questions, and handling feedback with empathy. Successful examples include Mayo Clinic, which uses storytelling and patient testimonials to create emotional resonance, building trust rather than simply promoting services. Social media also helps hospitals appear more approachable, human, and community oriented. However, this strategy requires careful management to prevent misinformation and maintain medical ethics. Effective social media engagement must be consistent, ethical, empathetic, and patient focused to create long term digital relationships. Technology is often seen as cold and impersonal, but in healthcare, it can actually strengthen human connection when used correctly. Transformative technology includes tools such as AI-based chatbots, telemedicine platforms, remote health monitoring, patient portals, and electronic health records, EHRs. These technologies improve accessibility and efficiency, but when combined with empathy, they also improve patient comfort and emotional security. For example, AI chatbots designed with warm language can provide 24/7 medical guidance while reducing patient anxiety. Telemedicine consultations can remain humanistic when doctors maintain eye contact, speak with care, and actively listen to patients' concerns. Patient portals empower patients by giving them access to their own medical records and treatment history. These tools support patient autonomy and health responsibility. However, technology must always support, not replace, human interaction. That is why emotional design, user friendly communication, and medical ethics are essential in digital health services. Based on the analysis, a humanistic digital marketing framework was developed to guide healthcare organizations in implementing a trust based digital strategy. This framework connects communication, emotional connection, and technology into one strategic system. The communication dimension focuses on educational messages, transparency, and credibility. The emotional dimension emphasizes empathy, respect, and supportive interactions. The technology dimension integrates AI, telemedicine, and digital platforms to improve accessibility and personalization. These three dimensions work together to strengthen patient trust and engagement. The framework ensures that digital transformation in healthcare remains ethical, compassionate, and patient centered. Instead of promoting services aggressively, this approach builds relationships and long term loyalty. It aligns digital strategy with healthcare values, making technology a tool for care, not just marketing. The proposed model explains the strategic process of implementing humanistic digital marketing in healthcare organizations. It begins with a strong strategic foundation built on transparency, ethical communication, and credibility. Then, it applies the three main strategies: educational content marketing, interactive social engagement, and empathy driven digital technology. These strategies lead to measurable results, including higher patient trust, satisfaction, and emotional connection. It also promotes patient empowerment, enabling patients to actively manage their health through digital platforms. Importantly, this model encourages healthcare providers to balance data driven decisions with empathetic communication. It emphasizes that successful healthcare marketing is not transactional, but relational, focused on long term relationships rather than short term attraction. This model is practical and can be applied by hospitals, clinics, telemedicine platforms, and home care providers. This study concludes that digital marketing in healthcare must be humanistic to be truly effective and ethical. Digital transformation should not eliminate human values, but strengthen them through meaningful communication. The findings highlight that trust and empathy are essential in building successful digital relationships with patients. The study identified three key strategies: educational content, interactive social engagement, and empathetic technology. These strategies help healthcare providers not only attract patients, but also build loyalty and emotional connection. The ultimate goal is patient empowerment, where patients become informed, confident, and active in managing their health. This approach supports long term partnerships rather than transactional care. In conclusion, technology should not replace human touch, but bring healthcare closer to people through digital compassion. Like any academic study, this research has several limitations. First, it is based on a systematic literature review, which relies entirely on secondary data from previous studies. Therefore, it does not include primary data from hospitals, healthcare staff, or patients. Second, most of the analyzed literature came from developed countries such as the United States and the United Kingdom. As a result, the findings may not fully represent the digital health environment in developing countries like Indonesia, where digital infrastructure and literacy widely vary. Third, the implementation of humanistic digital marketing may differ depending on organizational resources, especially for small clinics or rural healthcare providers with limited technology access. Fourth, the study does not measure the quantitative impact of trust and empathy on marketing outcomes, such as patient visits, loyalty, or satisfaction scores. For future research, it is recommended to conduct empirical studies using surveys, interviews, or case studies with hospitals to validate this model. Researchers could also develop implementation guidelines for healthcare institutions to apply this framework step by step. Additionally, future studies should explore the ethical guidelines for digital health communication, especially in social media management for hospitals. It is also important to test the model in different cultural contexts, particularly in Indonesia, where patient behavior and health communication styles are unique. Finally, future research could include AI ethics, digital compassion design, and data privacy to strengthen humanistic digital transformation in healthcare.